when you look at treatment for cellulite, okay, which is people usually talk about waviness or bumpiness, usually in the thighs, the treatments are broken down to non-surgical options and surgical options, and we're going to talk a little bit about both. I mean, obviously, to understand what's going to work best for you requires some sort of in-person evaluation, but the non-surgical option that works the best, and probably the only one that I think reliably works, is something called LPG, which is a company that makes a machine, or endermology. You may have heard of that. So how does it work? It's a massaging type mechanism, and we schedule for about an hour in the office. Not all that's actually doing the procedure. Maybe 45 minutes or 35 minutes is doing the procedure, and it's usually done once a week in multiple sessions. 5 sessions, 10 sessions. It's different for everybody, but that's a good place to start. Okay. Now, the surgical options really depend on what is the issue. If you have areas where you have extra fatty tissue, then for example, liposuction may be an option. If you have pretty low depressed areas, you may need to do fat grafting with liposuction. There are some people doing what's called little subcision, which is a little incision on the band that's keeping the skin tethered down. That's another surgical option. And if you have extra skin, then usually you'll need some sort of a lifting procedure like a thighplasty, or when you get an around the world or a lower body lift, that procedure will lift the outer thigh and oftentimes will smooth out the skin. You won't need anything beyond that. So there are a lot of options, and it's always good to start with a non-surgical option, particularly if you have a pretty mild case, and it works quite well. Thank you.